Welcome to the Body Shop Physical Therapy. Today I'm going to go over the Egoscue Method to address chronic elbow pain. Before I begin, I'm going to speak a word of life from 2 Corinthians 4:16. Therefore we do not lose heart. Though outwardly we are wasting away, yet inwardly we are being renewed day by day. So today I'm going to go through a menu of 8 exercises using the Egoscue Method to address chronic elbow pain. This can include things such as medial epicondylitis, lateral epicondylitis, also known as golfer's elbow or tennis elbow. And if we repetitively use our forearm over and over, sometimes we develop inflammation that can compress the median nerve, which leads into carpal tunnel syndrome. So this is a menu of 8 exercises that is going to help with the postural alignment to address the mechanics in the elbow region to help reduce that stress and strain, and over time hopefully help to diminish the pain that is being experienced. Please consult your medical doctor or physical therapist for the appropriateness of exercises for you. You can follow along with me and I'll take you right through this menu of 8 exercises. So the first exercise is standing chest openers. We're going to do unilateral and bilateral. The first one, we're going to do unilateral. So I'm going to stand with my feet hip width apart, toes are facing forward. My hand is going to be on the wall, but my fingers are going to be spread as wide as I can spread them, and my elbow is going to be straight. I want to then rotate my elbow back and forth, so picture a clock, and you're just rotating that elbow back and forth along that clock movement. Now I want to keep the elbow straight and I want the movement to come from the shoulder. We're going to do this rotation 10 times. So elbow goes forward and then backward. That's 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, and then I'm going to switch to the other side. My hand is going to be flat on the wall, arm width from the body, elbow straight, and rotating that elbow back and forth. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. We'll do 2 sets of 10. So back to the left side or back to the opposite side. And fingertips spread, elbow is straight, rotating back and forth. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, and last set, rotating that elbow back and forth. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. Then I want to do bilateral chest openers. So that's going to be the same thing, except we're going to do this with both arms at the same time. So fingertips spread apart, elbow is straight, toes are facing forward, feet are hip width apart, rotating that elbow in and then out using the shoulders. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, and relax. And one more set, so 2 sets of 10. Elbows straight. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. I will go right into hanging. Toes facing forward, tighten your thighs to keep the legs straight. You just want to forward fold, relax your head and neck, and you want to hold this position for 1 minute. So I am going to set my timer and just let my body hang. You don't want to stick your butt towards the ceiling. You just want to tighten the thighs, keep the knees straight, toes facing ahead, and let your body hang. If you do a lot of sitting, that can tighten the hamstrings, so we are stretching the back line, that whole superficial back line that goes from the bottom of the foot to the back of the legs, all the way up to the base of the neck, and just letting the body hang in that forward folded position. Keep the thighs tight. You don't want to allow the legs to bend. And just holding this. Breathing into it, 15 seconds to go, just hanging. And that completes a minute of hanging. Then I want to go into wall elbow curls. So I want to make a golfer's grip. My thumb is going to be extended, my knuckles curled, my first knuckle is going to be straight. So that's going to be my golfer's grip. Then I want to place my knuckles on the side of my head. My thumb's going to be facing down. We're going to be doing this movement, but we're going to do this up against the wall. We're going to do that 25 times. So wall elbow curls. I'm going to have my feet facing forward. My heels are going to be up against the wall. My legs are straight. I am going to have my buttocks against the wall and my upper back against the wall. So then I make my golfer's grip. Knuckles are on the side of the head. I'm going to bring the elbows together and then press them on the wall. 1, your mid back, your upper back is going to be up against the wall. Hips are against the wall. 3, 4, 5, 6, you want the elbows to touch in the center. 7, 8, 9, 10, 11, 12, 13, 14, 15, 16, 17, 18, 19, 20, my hands migrate, so I just reposition them. 21, 22, 23, 24, 25. And the next is going to be static extension. So you want to have something that you can kneel on that is comfortable. You can use an ottoman. I'm going to set my timer for 2 minutes. If you can only do 1 minute to start with, that is fine. You want your knees to be right under the hips, just apart, and then you're going to shift your hips over the knees about 6 to 8 inches, and you want your hands to be underneath your shoulders. So my hips are going to be shifted 6 to 8 inches in front of my knee. I'm going to drop my head down. I want my shoulder blades to sink towards my spine, and I'm going to take my buttocks and point my buttocks towards the ceiling to get that curve in my low back. So you should feel an arch in the lower back as you tilt your butt towards the ceiling. And you just want to hold this position for 2 minutes. And sometimes it takes a while to build the endurance up to hold with the arms. So 1 minute is fine to begin with, and just build up to that 2 minutes. And once you're here, you can take deep breaths in and all the way out. Breathing in, all the way out. minutes, 20 seconds to go. So again, just relax your head and neck, let your shoulder blades sink towards the spine, tilting your butt towards the ceiling to get that arch in the low back, and letting your abdominals relax, let everything stay relaxed with your hips shifted in front of the knees, and just hold right here. All right. After that, we're going to do standing wall clocks. So you want to find a space up against the wall. These position holds are going to be for 1 minute, and you want to picture a clock. First position's 12 o'clock, we'll go 10 and 2 o'clock, and then 3 and 9 o'clock. Feet are going to be in a pigeon-toed position up against the wall. So first position, you're going to go into that pigeon-toe position. You're going to be up against the wall. Thumbs are going to be pointing away from the wall, and you want to hold right here for 1 minute. And you want to be up as close to the wall as you can, and taking nice deep breaths in and all the way out. And I'm going to walk up so that my toes are touching. You want to keep the abdominals relaxed. After holding that for a minute, we want to go right into 10 and 2 o'clock. And so here, pigeon toe position. Thumbs are going to be facing away from the wall, and you want to slowly work on rotating those thumbs more and more away from the wall as you can, so you're externally rotating those shoulders. If you're having pain in the elbow, then you do not want to do this. So only if you can do this without pain in the elbow, you can build up to this if you're having discomfort in the elbow. And after 1 minute, 1 minute of holding there, you then want to go into the last position, 3 o'clock, 9 o'clock, for 1 minute. And pigeon toe. Thumbs are going to be pointing away from the wall, and work those thumbs further and further away as you rotate the shoulders, taking a nice deep breath in. Keeping that after a minute of holding, that completes those exercises, and then I want to go right into a cats and dogs. So I'm going to come down onto the floor. My hands are underneath my shoulders, my knees are underneath my hips, and I'm going to round out my back, drop my head down, and then I'm going to arch my back and look up, and I'm going to do 10 of these. A nice smooth movement. So 1, looking up, 2, looking up, 3, 4, 5, 6, 7, 8, 9, and last one, rounding out and looking up. Nice smooth movement. So that's cats and dogs. The last exercise is going to take the longest. It's progressive supine groin, and that is going to be long hold. So what you want is a chair that you can put one leg in a 90-90 position, and then you can use a stack of books or some type of ladder. So I'm going to use an actual step stool ladder, and I'm going to place my heel on the step stool ladder, and then one leg in a 90-90 position. So I'm going to have my left leg in the 90-90, and then my right heel rested on the stool. I want to set the timer for 3 minutes. So this can be anywhere from 3 to 5 minutes. My palms are going to be facing up towards the ceiling, 45 degrees away from my body, and my toe on my leg that's extended is going to be facing back towards me. So my foot's going to be back towards me. It's my heel that should be rested on the ladder, and I just want to relax into this position and let my low back to sink down into the floor. So this is a really nice postural position and hold to help relax the muscles, the postural muscles in the pelvic region. So your hip flexor is going to be relaxed on that left side, and then it's a nice gentle elongation of the hip flexor on the leg that's extended as I keep lowering it down. So you can do as many different levels as you need to, and lowering that foot 5 to 8 inches through each hold or progression. And the idea is for the back to relax down to the floor. So if the back is not relaxed all the way down after 3 minutes, you can hold up to 5 minutes. And so I'm going to do 3 levels on this side, so that's going to be 9 minutes, and then switch and do the same thing on the other side. So it does take a while to go through. It should feel good to the body to be in these positions. And while you're here, you can work on your diaphragmatic breathing and just relaxing the abdominals, relaxing the shoulders. So when you breathe in, focus on where the breath is. Don't allow the shoulders to rise up to the ears. You want to breathe from the diaphragm, the lower part of the rib cage, pulling the air in from that muscle. And let's see where we are on our timer. So we've got less than a minute to go for this position. And you just want to hang out here and relax, taking a breath in, all the way out, breathing in, all the way out, breathing in, all the way out, and I want my heel to be rested on the next step, so I'm going to move away just so that I can place that heel right there. I'm going to go as far as I need to so that it's just my heel. Toe is facing up. Arms are 45 degrees away from the body. So I've got my arms 45 degrees, and then I'm just relaxing in this position. Toe is facing up. Don't let your foot go out or in. You want the toe to be straight up towards the ceiling. And just relaxing in this position. And as you are holding this, you can play with the breath, and we can then do some box breathing on this next hold of 3 minutes. So I'm going to breathe in for a count of 4, hold for a count of 4, and then breathe out for a count of 4. So breathing in, hold, and exhale. Breathing in, hold, and exhale. Breathing in, hold, and exhale. And breathing in, hold, and exhale. And just relax. Allow the low back to sink down into the floor. We've got less than a minute to go. Taking a nice deep breath. And the last position is just going to be, and I'm going to move the ladder up just so I can hold my foot upright. So the leg stays straight, and I'm just staying in the same position. And the same thing, allowing the low back to sink down into the floor. And as I do this, I'm going to do some diaphragmatic breathing. Now the diaphragm is attached to your hip flexor, and this is a nice gentle way to extend the hip flexor on this extended leg. So as you take deep breaths in and you're pulling with the diaphragm, you're then allowing to work in that stretching on that line that blends right into the hip flexor. So it helps to give a stretch in that lower pelvis and mid-back region. So taking nice diaphragmatic breaths, breathing in, all the way out, breathing in, all the way out, breathing in, breathing in, all the way out, and a minute to go. should feel the back slowly coming to rest onto the floor. Everything's relaxed. Just holding that foot in that position, toe facing up. 10 seconds to go. 9, 8, 7, 6, 5, 4, 3, 2, 1. Okay, then I just want to switch so that I am going the other direction. And so I am going to then reposition so that my left leg is going to be on the ladder, and then my right leg is going to be up over in that 90-90 position. So I've got my 90-90 position, and then my opposite leg, the heel, is resting up on a ladder. So I'm then bringing my arms 45 degrees away from my body, and I'm just holding this position for 3 minutes. And again, don't use your abdominals to force the back down. Relax your stomach, relax your abdominals, and allow the back just to slowly sink down into the floor. We'll work on our diaphragmatic breathing. And remember, you can hold up to 5 minutes in each position if the back has not relaxed all the way down by the time you get to the 3 minutes. Seconds to go for this position, holding that toe up towards the ceiling, relaxing the shoulders. Then I'm just going to pull this closer so that I can go stay in that 90-90 position. And then my heel is rested on the next step. And same thing, going right back into this hold. 2 more 3-minute holds, and then we are done. So taking a breath in, let's play with the breath, and let's do some box breathing. So I'm going to breathe in for a count of 4. Hold, and then breathe out. Breathe in, hold, and exhale. breathe. And for the last is going to be the foot just right on the floor, so coming down to the floor, resting, toes facing up, and holding here for the last 3-minute hold, focusing on the breath and allowing the back just to relax down to the floor. So I'm going to go back to diaphragmatic breathing, taking nice deep breaths in and then exhaling, nice slow exhales. Pay attention to the shoulders when you breathe in so that you're not bringing the shoulders up towards your ears. Probably about halfway there, yes, a little more than halfway there. Just letting the back relax down to the floor naturally. Feeling the ribs anchor down to the floor as you pull the air in. Almost done. Looks like we have a visitor. 10 seconds. 9, 8, 7, 6, 5, 4, 3, 2, 1. And that completes the Egoscue method to address chronic elbow pain. I hope this is of help and have a blessed day. Thank you.